Thank you, Seth. Excellent words that he has shared with us, and it's really exciting to see how many alumni from the Academy is here, as well as current active fellows. That's right, we're taking over. So anyway, good morning to everyone, and welcome to the inaugural Texas Coalition for Healthy Minds Behavioral Health Policy Summit, co-sponsored by us, the Hogg Foundation for Mental Health. As Seth said, I'm Dr. Octavio N. Martinez Jr. I'm the executive director of this wonderful foundation that has been around since 1940. We've been instrumental in helping to create the mental health infrastructure of the state of Texas since that time, and we will continue to do that with you today and into the future. The foundation has been working to improve the mental health and well-being of Texans, like I said, for over 80 years, through strategic grant making, because we are a foundation, through research, learning initiatives, and yes, policy. We fund inclusive, collaborative community change efforts, capacity building, policy advocacy, and research, all with the goal of strengthening mental health for the people living in Texas. And please key on the fact that we are in strengthening mental health. That does not mean that we ignore mental illness, because obviously that's extremely important. But our mental health is really being much more preventative, much more upstream. So therefore, the places where people live, learn, work, play, and pray can have a significant impact on improving our mental health. Therefore, we know that anyone in a community, not just mental health and substance use professionals, can and should be a part of the process to strengthen local conditions that support resilience, mental health, and well-being. This includes everyone in Texas. To set the stage for today, let's remind ourselves of the mental health and substance use landscape. Number one, mental illness can affect anyone at any age. That's why it is such an important cross-cutting issue. Number two, mental health is part of overall health. As the World Health Organization many decades ago stated, there is no health without mental health. Number three, 1 in 5, yes, 20% of U.S. adults experience mental illness each year, and yet less than half are still receiving care. And even less than that are receiving evidence-based care, let alone culturally and linguistically competent care. Much work to be done. Number four, half of all chronic mental illness begins by, you guys should know this, the age of 14. So in fact, mental illness is very much an illness of youth and young adults. And as we grow older, we're just suffering with what happened and started when we were really quite young. Number five, suicide, and this is a really unfortunate statistic, is the third leading cause of death in the United States for individuals between the ages of 10 to 24 years of age. That is a very sobering, or it should be, statistic for all of us to take note. Number six, it's estimated Texas has seen over 26,000 overdose deaths over the last 5 years, translating in over 26,000 families, children, parents, friends, and communities who have lost a loved one. That, folks, is also unacceptable. And number seven, recovery is possible, right? That has been such a huge paradigm shift, by the way. As a psychiatrist, when I went through medical school and residency, that's not what I was taught. That is why we are all here today, because recovery is possible, and recovery is hope. Hope for the future of Texas, hope for all Texans to achieve well-being. We all want to work toward policy solutions to improve mental health and well-being for all Texans. The Texas Coalition for Healthy Minds is instrumental in finding and supporting policy solutions by convening mental health and substance use stakeholders of all stripes to work together in the Capitol. Yeah, it's right over there. Hogg remains committed to supporting systems change efforts through convening, collaboration, and coalition building, because we know that coalition is stronger because of its members rather than us working alone or individually. We know that our current environment can be full of challenges, lingering stigma of mental health, and lingering stigma of substance use disorders, lack of lived experience at the Capitol, or at least willing to acknowledge it, and continued funding gaps for prevention and community-focused services. However, legislators, advocates, and organizations are committed to meeting these challenges head-on. That's what we're here for today, so let us agree to get to work. With that, I want to thank Seth Winnick, Coalition Director. Where'd he go? There you are. You're right in front of me. For coordinating the logistics of this incredible summit and ensuring we have this meeting space and all of this great food today. Let us also thank the Coalition Steering Committee for organizing, leading today's panels and breakout rooms, which we know will be a fruitful day of discussion on policy challenges, but more importantly, putting our brainpower together for solutions. So let's thank them. With that, without further ado, let me hand this over now to Will Francis, Executive Director of the National Association of Social Workers, Texas chapter, to kick off this amazing morning.